as they come
Okay.
along. So,
Well, welcome everyone online. Thank you so much for joining us. This is a really important conversation for our communities, for our country, for a whole bunch of reasons, which you're going to hear some wonderful reasons why. I'm Val Jensen. I use she, her pronouns, and I am the secretary of the League of Women Voters of New Hope area. And we have a new name, so we're very excited. And we are really honored tonight to be able to bring you two very distinguished panelists. And they are going to talk about to us, and I'm going to ask them some questions about some really important issues going on in this space. We are going to listen. I will have questions. We will listen to our panelists, and then we will have time for questions at the end of the program. So I hope that you can wait. There will be, if you put questions in the chat, they will be moderated so that we can hopefully get those questions as well. And so if there's any other questions or if you're having any other issues, please put that in the chat as well. And we will be trying to monitor that. Again, welcome tonight. I'm really excited to have with me two really distinguished people. First, Laura Mortenson is the communications director for the Minnesota Budget Project. She manages media relations and oversees communications outreach to promote the research and advocacy efforts of the team. Her professional background includes serving as communication director for a St. Paul mayor and managing public and media relations for city organizations. Laura received a BA in journalism from the University of Wisconsin-Eau Claire. We also have Mr. Trevor Sawallish. He is North Memorial named Trevor as the new CEO of effective February 9th, 2024. Mr. Sawallish has more than 20 years of experience in healthcare, most recently serving as North Memorial's Health's Chief Operating Officer. Mr. Sawallish is an accomplished leader with extensive experience across the healthcare sector, including executive roles at Dean Clinic, Children's Minnesota, and SSM Health. He has made a significant contribution at North Memorial with a focus on operational discipline, safety, and optimizing patient experience. Thank you both for being here with us tonight and for sharing all of your years of experience. I'm going to start out just talking a little bit, giving you some background, and then we're going to go to Laura. And Laura's going to talk to us about Medicaid in Minnesota, which is also known as medical assistance. Um, Laura, can you provide an overview of this information, of Medicaid and kind of what's happening? Or would you like me to provide some information and then begin questions?
my presentation has a big overview of
Oh, good.
Medicaid and
Perfect.
also how HR1 is impacting Medicaid. But if I don't answer
Perfect.
the questions in the presentation, absolutely we can follow up. Does that make sense?
Perfect. So go ahead, Laura, please take the floor.
Okay, great. I'm going to share my screen. Let's see if I manage to do this. And let's see. Are people seeing my presentation? Excellent. Great. Thank you so much. Hi, everybody. Thank you so much for having me tonight. I really do appreciate this opportunity to share what I have learned and what we know about Medicaid, and most importantly, what's the impact of HR1 on Minnesotans in this year and the years ahead. I'll share a little bit about myself. I have been in communications and policy work since I graduated from college. And as my bio said, I was at a suburban newspaper, and then eventually I ended serving as a communications director for a city mayor. But for a time in between formal employment roles, I was a caregiver for 9 years. I was a stay-at-home mom to two kids. I was a breast cancer survivor or patient and now survivor. And for 17 years, I was the full-time court-appointed guardian of my dad, who was also the caregiver of my mom before she passed away. And those years of intense and chaotic caregiving underscored for me just why we need to radically change how we do healthcare in this country. We need to focus our healthcare systems on people, the people who need the care, the people who deliver that care, and also the people who provide those essential supports for their loved ones. And those years actually fuel my passionate advocacy for Medicaid and envisioning a people-centered healthcare system today. So I've been with the Minnesota Budget Project for 10 years. As Val said, I am comms director, and I currently co-lead the largest Medicaid coalition in the state. A little bit about the Budget Project. It's one of the ways that the Minnesota Council of Nonprofits advances its goals for a healthy, cooperative, and just society. For more than 25 years, we've been a research and advocacy program that identifies and advances policy changes so that Minnesota can become a state where everyone can thrive. And we work primarily in the areas of tax, budget, and economic policy. So last year, when it became clear that the congressional leadership intended to drastically change Medicaid, my organization and more than 90 healthcare organizations and advocate organizations from across the state came together to raise awareness and defend against the large and harmful threats to this critical safety net program. So I'm going to provide a little bit of context for some of the pressures and threats to Minnesotans' health and economic well-being resulting from those federal decisions. And then I'm also going to share some thoughts on how we can all inform and influence what's next and to put Minnesotans and their communities first. So I will give you a little bit of an overview of the Federal Reconciliation Law. It's also known as the One Big Beautiful Bill, or H.R. 1. The Federal Reconciliation Law will be the largest transfer of wealth from working class and middle class Americans to the wealthy. I'm just going to repeat that again. It will be the largest transfer of wealth from working class and middle class Americans to the wealthy. It does that by providing massive tax cuts that primarily benefit the wealthy. It offers the biggest funding cuts, or it gives the biggest funding cuts in history to our nation's core basic needs services, including healthcare and food assistance. It transfers a lot of responsibilities to the states while at the same time cuts funding to the states. It excludes immigrants, including those with legal status, from many public services, and it funds a massive deportation and detention program. And finally, it increases the federal deficit, which some will use as rationale for further rounds of funding cuts to essential services. Some of the harmful impacts that are happening have already gone into effect. It's a massive law, so I'm really only going to highlight the impacts on Medicaid for tonight. And the major theme is that many Minnesotans will lose services that help them afford food and health care, while the state and counties will have to spend more money to add red tape and bureaucracy to serve the public less well. Some of those impacts are being felt already. As you can see, upon enactment, certain services were taken away from non-citizens. By January 2027, states will need to implement the new Medicaid work reporting requirements. And by fall of that year, the restrictions on how states can fund their Medicaid programs and the requirements for states to cover a significant portion of SNAP benefit costs will likely go into effect. So for Medicaid, it is the nation's largest provider of health insurance, and it's shared responsibility between the federal government and the states. In Minnesota, as Val said, Medicaid is called medical assistance. And through Medicaid, people of all ages can get the care and services they need when they need them. But H.R. 1 takes away healthcare coverage and raises out-of-pocket costs for everyday Americans. Nationally, Medicaid will see a $1 trillion cut. And some of those cuts are folks will now need to meet work reporting requirements to maintain their Medicaid coverage. And that includes folks who are parents and caregivers of children over 13, people without children, ages 19 to 64. And that's despite the fact that we know the majority of folks who get their health care through Medicaid are already working. The HR1 also makes deep funding cuts that may result in hospitals and nursing homes cutting services or even closing. It sharply restricts how states can raise money to fund Medicaid and includes elimination of health coverage for refugees and people granted humanitarian protections. For in Minnesota, the state of Minnesota currently estimates that over 140,000 Minnesotans will lose their health care coverage. The state of Minnesota will also approximately lose $1.4 billion in federal funding in just the first 4 years. So it all adds up to taking away coverage, raising costs for everyday folks, and shifting costs to states. A little bit more on what work reporting requirements means. Essentially, it just means adding unnecessary red tape. They start at the beginning of 2027 unless the state is granted an extension, and about 320,000 Minnesotans are likely to be subject to these new rules. It means that folks who are sometimes referred to as the expansion population, these are low-income adults ages 19 to 64, and they're not caring for dependent children, and they're not enrolled in Medicaid through a disability waiver. And so they're going to have to prove that they are working or engaged in community or public service or seeking employment or in job training for 80 hours a month. And these rules, we believe, are unnecessary because 91% of the expansion population is already working or in school or are a caregiver, or they have health issues that limit their ability to work. Minnesotans at risk of losing their health care include, again, those people who are working in jobs that offer inconsistent number of work hours per week, and those people who do not meet requirements but are unable to successfully navigate these complex reporting timelines and arduous paperwork. Evidence from other states has shown that work reporting requirements do not increase work and instead just lead to loss of healthcare coverage. Strict rules that require people to consistently work a set number of hours every week do not match the reality of low-wage work, including the fact that it's often the employer who determines how many hours of work is available, and some people live in places with few job opportunities. Work requirements simply make life and good health harder for low-income people by erecting barriers to getting health care. I will mention a little bit more about the Affordable Health Care Act and the expiration of the enhanced premium tax credits people have been hearing about in the news recently. So since 2021, enhanced premium tax credits have kept health insurance premium costs down for most people who buy their health insurance on the marketplace. And here in Minnesota, that's known as MNsure. These are Minnesotans including farmers and independent contractors, early retirees, and people who don't have health insurance through their employer. If they expire, estimates say that premiums will rise for 89,000 Minnesotans across the state. And an estimated 19,500 people across Minnesota will lose all financial help. Some people are likely to be priced out of health insurance altogether. And as you know, without health insurance, people are less healthy, hospitals see increased costs, and the economy is worse off. Here is one example of a map that shows per congressional district how many Minnesotans could be expected to be harmed by the expiration of these EPTCs. We also have this on our website too, so certainly feel free to take a look at that. Finally, I do want to mention that HR1 deeply impacts nonprofits, and along with a lot of other things that have been happening over the last year since the Trump administration came into office. As you know, nonprofits do incredible work. We step up in times of crisis, but even we have limits. So some nonprofits are expected to see a loss or reduction in state funding that comes directly to their nonprofit. They also can be impacted by funding reduction for services important to the people or communities that they serve, and that can create even a greater need for their services. For example, one of the most painful outcomes of this past state legislative session was the decision to roll back eligibility for affordable health care coverage through MNcare for undocumented adults. But the impacts are not across the board, and some programs may see funding increases. But the graphic on this slide shows these factors that are adding up to challenges for nonprofits. While expenses for nonprofits and demands for services are expected to rise or have been rising, at the same time, foundation grants and corporate giving and individual giving are expected to decline. So instead of ending on that note, I do want to say that there are things that we can do that we should do, and this moment calls for. So these federal cuts are vast. Nonprofits, philanthropy, and the state cannot fully fill in the gaps that HR 1 creates. So we're called in this moment to take bold action. We can't allow 140,000 Minnesotans to lose their health care. We can't allow unsustainable cost shifts to healthcare providers and hospitals that puts Minnesotans' access to care at risk. We can't allow tens of thousands of Minnesotans to go hungry, and we can't turn our backs on our immigrant neighbors. So our collective work pivots to acting boldly in our own capacities to mitigate the harm and protect targeted folks and communities. We are busy documenting the harm that are done from these federal decisions as one step to eventually reverse them and build something better. And we're working on informing and influencing state level decisions to mitigate that harm. At the Minnesota Budget Project and at MCN, we're calling on our state level elected officials to take bold action to prioritize and protect Minnesotans' health and economic well-being. We're asking them to not simply mirror the targeting of certain public services or groups of people who are reflected in these cuts of the federal actions. Minnesotans should not be excluded from public services because of their immigration status or other identities or circumstances beyond their control. And raising revenues, public revenues, especially from those with the most resources, must be part of the state's response in order to protect crucial services and meet Minnesotans' needs in these unprecedented times. So I'll end with a slide on how to learn more from the Minnesota Budget Project. As I said, we do analysis and briefs. We have a whole page on the federal actions and briefs and analysis that break down individual provisions. You can subscribe to our newsletter and follow us on social media. And that's what I have for you right now. And I'm happy to either take questions or go into another discussion.
Well, there's a couple questions that I think would kind of round out all of the amazing information that you've already given us. And thank you so much. I mean, the information is critical and people need to fully understand the impacts of these, particularly on our most vulnerable populations. And so it's wonderful to have you lay that all out for us. Do you know if there's been any discussion to begin tracking the impact of this on things like chronic conditions, right? Like, are we going to be able to track the decline in health and deaths with the loss of medical assistance and health insurance in general? I know that's a big ask, but do you know if there's any discussions going on around that at the legislature?
I haven't heard specifically. Our coalition called This is Medicaid has been in conversations with the governor's office and staff, with the agencies at DHS and Minnesota Department of Health, and with advocates, as I said, across the state. I mean, among our goals in our state and across the nation is to stop or mitigate the harm from these provisions, to delay the implementation, and then, as you said, to document the harm as these changes begin to impact people. We need to know that these provisions are already hurting and harming people and keeping them from getting the care that they deserve and need. And then we need to articulate what are the changes that state policymakers have to do to protect folks. I don't know specifically if the state is working on that aspect right now. So I can't answer that specifically. I do know that among all of our advocate partners in the Medicaid coalition, that they are doing their own assessments and their own, among the care that they give to folks and among the people that they're talking to. So it's happening formally in organizations. I don't know yet exactly what the state is doing.
Thank you. Thank you for answering that. Lastly, and this is not a ringer, but we know that there's been a lot of discussion about waste, fraud, and abuse. And it's kind of at the front of conversations, largely because there's been a spotlight on Minnesota for certain reasons. Is there a message to counter waste, fraud, and abuse? And for me personally, I think things can be overblown about the actual percentage, but because it's in the headlines, I know that it's being looked at, but is there any messaging or anything that people are thinking about around that?
Sure. This is something that I have been working on my entire career in a
Okay.
variety of ways to counter um, some folks' narrative that want
Mm-hmm.
to shape government and the people who work in government as,
Mm-hmm.
and frankly, in nonprofits
Mm-hmm.
as less than, you know, less than, I'm losing my words, but as not doing their jobs.
Yep.
So a few thoughts on fraud, waste, and abuse right now. It's We always show that there's a reminder there's a small number of people that have been involved in these high profile cases that are now being centered in the national news.
Mm-hmm.
It's another good reminder to know that it's generally not the enrollees who are committing the fraud, but there are a few people who are gaming the system, like in many other criminal opportunities, and many of those that don't make headlines. And
Mm-hmm.
that's either in government, in nonprofits, in private sector.
Absolutely.
What we as narrative folks and advocates for who believe that our services and our analysis is just as important, that our narrative is just as important as our advocacy, the
Mm-hmm.
most effective way to counter misconceptions is through storytelling, is really from hearing from Minnesotans, our neighbors, our family members, for example, in Medicaid, who get healthcare through the many supports of Medicaid, how it's a
Mm-hmm.
true safety net, and that the vast majority of Minnesotans are just trying to get the care that they need so they can live healthy lives, they can work and contribute to their community. 1 in 5 of us at some point in our lives have had to rely on Medicaid and those multiple supports.
Mm-hmm.
Um, so if we just talk to a few of our neighbors or family members, we actually get a true sense of what Medicaid has been doing and the headlines that we're seeing and the work that the state needs to do to ensure, accuracy and transparency, that is going to go forward. But part of our role as advocates is just to remind folks how essential Medicaid is, and to counter the other goals of some other folks who think that we don't need these types of safety net services. And I for one, know we in fact do need these types of services. I will also point to a resource that MCN, the Minnesota Council of Nonprofits, has. I will capture this link and try to share it in the chat. Um, Nonprofits are undergoing a lot of threats and narrative misconceptions that they are trying to grapple with, and so they provided some talking points. And I'm going to try to do
Mm-hmm.
that now in a way. Multitasking is sometimes hard. But let
No
me
Thank
problem.
share this
you.
resource in the chat
No
and
problem,
people
Laura.
could
We
take a
can
look at
send it
that.
out. We'll send it
Okay.
out
Yep.
for you.
Oh, she got it in the
I
chat. Thank
think
you
I
so much.
managed it.
Got it.
Yeah. And then we can also send it out as a follow-up. Well, thank you so much, Laura. All of the information you gave us is phenomenal. You know, like you said, personal stories are so critical. When I moved, I had left Minnesota and moved to another state and came back, and took a job at a very small nonprofit that didn't have health insurance. And they gave me money to buy health insurance, but this was before the ACA, and I was denied by every single insurance company for a pre-existing condition. I was a single mother of 2 children, one of them autistic, and so all of a sudden my family didn't have health care. I'm diabetic. I ended up, thank God for our community health centers. who took uninsured people at the time, or I wouldn't have been able to have the care that I needed to be able to take care of my two little boys. And so even if you have money, but if without the ACA, I would not have, I wasn't able to get insurance. And thank God I lived in Minnesota where I was able to get care, right? Get insurance after a 6 month period. But if it wasn't for community health centers in the state that I live in, I'm not sure what I would have done. And that was the first time in my life that that had been a situation. And so working for a nonprofit, doing the yeoman's work, but people don't understand the individual impact that it has. And paying $800 a month for my medication because I didn't have insurance. And so just all of those stories, you're right. Those are stories that impact, and people need to understand that. So thank you so much. We are going to turn to Trevor Sawallish. Thank you, Trevor, for being so patient. Could you provide us a brief overview of what percentage of patients have medical assistance and the impact of support and the impacts of supportive medical assistance has on North Memorial? North Memorial offers so many arenas of care, and can you just kind of comment on that relationship between medical assistance and these arenas?
Sure. First of all, I'd just like to say thanks to League for having me and for paying attention to this issue because it is really critical. We are at a very critical time in healthcare, and this clearly is going to be one of the major factors as to what happens over the next 10 years relative to healthcare in this country. I also want to thank Laura for setting such a great foundation for everything. Really quickly, North Memorial, again, for those that don't know the system, we have two hospitals, one in Robbinsdale, Minnesota, which is our level one trauma center. We have about 350 beds, and we serve all of Minnesota because of that level one trauma center. But in particular, we serve a unique population north Minneapolis and in the Robbinsdale area, and really do consider ourselves to serve a safety net function with Hennepin County Medical Center. And then we also have our Maple Grove Hospital, which is, also a very important facility for that community. That facility is known for delivering 5,200 births a year, which tends to be a very significant Medicaid population as well, because that's moms and babies that often don't have the resources that others do. We have 26 clinics across the Northwest Metro. And then the other part that a lot of folks don't know about North Memorial is we cover 8,500 square miles of Minnesota territory with our ambulances. So
Wow.
you call 911 in Minnesota very often is a North Memorial ambulance that comes to your aid. We also have 9 helicopters that serve 5 states in getting the most critically injured or needing or ill patients where they need to go. So, especially at our Robbinsdale campus, 75% of the patients that walk through our doors historically are on some sort of government payment, whether that be Medicare or Medicaid. Historically, it's been about 25% of our patients are on Medicaid. Um, which the one thing that I would emphasize about North and most of the health systems in Minnesota is we are truly nonprofit, which means we don't pay attention to what is the insurance card, whether or not you have insurance at all, whether you're government payment or not. We truly are there to serve people. And I really appreciated that this is a human business. All we really want to do is serve people that need us. Um, Before any of this started, we were already struggling with how much Medicare and Medicaid pay relative to our costs. In 2024, we lost almost $160 million with the costs that we have for delivering care to Medicare and Medicaid patients that wasn't reimbursed by the government. That's before one big beautiful bill and $1 trillion was going to come out of it. So now what we're facing is a scenario where we were already on the edge. We were already at a point where we could not sustain a lot of the services that we provide. If any of our LinkedIn with me, you saw I've been advocating at the state level, at the federal level for almost 3 years, trying to make sure that there's appropriate reimbursement so that we can just serve the people that we need to serve and be around in 10 years. But this $1 trillion coming out is going to be a huge impact to us and really likely mean that services are going to have to be different because while we don't get paid for everything all the care that we deliver, having some payment is much, much better than no payment at all. Even with redetermination that happened in the state for the Medicaid population a couple of years ago, we saw a decline in the number of Medicaid patients and a sharp increase in the number of patients that were trying to pay out of pocket. Most of that is just uncollectible for us, which means we're not going to
Yep.
get any reimbursement for the care.
Thank you.
Maybe one other thing that I would emphasize, and we can talk about this as a Medicaid issue,
Mhm.
but when hospitals are at the edge and hospitals are struggling, even if you accept that Medicaid patients don't deserve care, which of course none of us do, it's not just a Medicaid issue because if hospitals can't provide the services that they provide, it is a Medicare issue as well. It is a commercial
Yes.
population as well. It is everybody in the state that's going to suffer because of these cuts to Medicaid. And by the way, we should just be delivering healthcare to anybody that needs it, irrespective of what their ability to pay should be.
Thank you. Um, One of the things that it says, so prior to the big beautiful bill, Medicaid allowed eligibility to look back 3 months. There's new limit. The new law limits provisional eligibility, which impacts so many people, right? Once they are hospitalized or for medical bills in general. With the new look back of 1 month versus 3 months, what financial impacts will this impose on hospitals, medical providers, and for individuals with, different medical conditions?
Yeah, the one thing I would say is it's hard to quantify that. And certainly when we saw redetermination, which took a lot of people off the rolls and then we had to re-enroll them, we saw that sharp increase in self-pay that I already described. And let me
Hmm.
just describe the scenario in which we're trying to get these patients enrolled. So often they come to us through the emergency department and they are sick or they are injured. That's a really hard time to be talking about them. Let's get you enrolled in Medicaid, right? So then they leave. And many of these patients that we're serving have complexities in their life. They're not focused just on, filling out the long and sometimes complicated application for Medicaid processes. So the fact that they've limited that window means, we can't and shouldn't be talking about them when they have clinical needs, they're sick, they're injured. We try not to really focus then, but then when they're discharged, they don't have those needs anymore. That window of time is incredibly difficult for us to get somebody enrolled, given the complexity of that process, especially when there's even more requirements to prove you're, seeking employment or anything else. It's just going to be that much harder to get these folks enrolled in the program.
Yeah, you talked briefly about, and I watched some videos of you testifying, right? What are, like, what do you foresee that the state is going to need to do, right, to make up this dollar difference, if it can, to be able to retain institutions like North Memorial and other hospitals? I'm sure there are also regional hospitals, right? Greater Minnesota is, extremely underserved in a lot of ways, but what do you see the state needs to do to make up the differences here, if at all possible?
I really do doubt that it is possible. You can't take $1 trillion out of the system. And the one thing that I would say, especially when it comes to the doctors, the nurses, the clinics, and the ambulances,
Yeah.
I'm sure fraud, waste, and abuse is a consideration, but those are the safest dollars you could ever spend in the country
Yeah.
because you're providing care at the point that that care is provided. So taking $1 trillion out is going to be really hard to make up, but I do think the state has to very much focus and prioritize on maintaining the healthcare system in the state. And your point is, I'm here speaking, as a representative of North Memorial, but the rural hospitals rely on Medicaid. The urban hospitals rely on Medicaid. The ambulance system relies on Medicaid, and that's all interconnected. If one part fails, it's only going to make it that much harder for every other part to survive. So the first thing is they need to make it easy for people to enroll in Medicaid, because if you only have a month, it has to be as
Yep.
easy and simple as possible, and there needs to be resources to help patients do that. The second thing is they need to prioritize funding to try and make up as much of that gap as they can. And then the third is they would need to work collaboratively with the rest of the healthcare system so that we can really start solving this problem together, as opposed to it being kind of an administrative, sort of imposed process to try and fill the gap. So those would be the three things at the top of mind.
Thank you. That kind of brings
If,
me to, oh, go
oh,
ahead.
sorry, if I can jump in, I
Yep.
mentioned it at the end of my presentation, but Just for some context, in 2023, Minnesota received about $12 billion in federal Medicaid funding. And as Trevor noted, that's not just serving Medicaid people as we imagine people going to the doctor or the hospital and saying, I'm a Medicaid person and I'm getting services. That is the foundation of our medical system in Minnesota and frankly across the nation. That's why nonprofits, including us, 501c3 nonprofits that are in the nonpartisan space, as well as our partners in the C4 space, as well as unions and a lot of other folks are coming together to really say the long-term solution of this is raising taxes and raising revenue from the folks that can afford to spend a little bit more. We did it in 2013 when we increased our income taxes. We added a fourth tier to our income taxes. That ended a decade of deficits in our state budget. It is time to do this again. We have resources. We are one of the most, across the nation, we are one of the most wealthy nations in the world. Minnesota has its share of folks that can invest more in the public services that serve folks. And sorry, I'm getting a call. And we can't leave that off the table as part of our solution.
Thank you. Trevor, can you explain, probably better than anyone, what is the safety net if a North Memorial closes? Where, people want to know this impacts individuals' lives, right? This, like you said, everything is interconnected. And so as somebody who lives down the street from North Memorial, it's a big employer. I mean, it's all the things, right? So what happens? What is the safety net? Jill asked in the chat, have discussions started about having to close and what that looks like?
Yeah, first of all, I don't know the answer to that. And in 1997 was my first healthcare job. I've been at this a very, very long time. This is as bad as I've ever seen it. And the answer of what happens without a North Memorial is a scary one to contemplate. I truly do believe that these cuts, if not moderated or managed somehow, will mean lives, will mean the health and security of the population that we are charged to take care of. Without a North Memorial, the pressure just gets bigger on HCMC, and we all know that they aren't doing that well as a kind of starting point for that conversation. Without some of these rural hospitals, people are going to have to go where they might have to go 25 minutes, which is already too long to get to a hospital. They might have to go 45 minutes to an hour. That will cost lives. And oh, by the way, the ambulances also rely on the Medicaid services that we provide. So there's a whole nother layer. And I don't mean to say that to be dramatic. I really do worry that that is the reality that we're facing. And I do appreciate the comment that we have $50 billion coming to the state in terms of the rural healthcare grant through the One Big Beautiful Bill. They're taking $1 trillion out and putting $50 billion back into, and forgive me, that's only $1 billion coming back to the state if we're accepted for the grant. Taking $1 trillion out and putting 50 back in is a nice thing to be able to talk about, but it really doesn't do much.
Thank you.
Right. And excuse me, but does that the amount of dollars that are allocated for Medicaid, does that also include nursing home dollars that Medicaid pays for?
Yeah, I believe it does. I'm not an expert in that.
I believe it does. So that makes the pot for North and Hennepin even smaller.
Right, and again, I like to claim that we're the poorest with HCMC. We're definitely the poorest of the hospitals, but it affects every single hospital system. Alina and Fairview, and we compete all the time. But at the same time, we're all here just to take care of the population of Minnesota, and all will be affected by it.
Right.
Thank you. Thank you.
Sorry. Unless you have a question.
No, go ahead. No,
to
jump
that
in.
point, I mean, Medicaid, think about our healthcare system. It's public health, it's hospitals, as we were mentioning, it's mental health centers, it's the home care, community clinics, nursing homes. It's not Medicare that pays for the care in nursing home, it's Medicaid. Physicians, dentists. It's in our schools. It is absolutely interwoven in all of our communities. And I think people don't, it's a little invisible. And what our coalition has been doing, and what's so important of these kind of conversations, is to really have more people understand how essential and interwoven Medicaid is in all of our community structures, and that we need to speak up about it and really show the impact that it's going to have in our communities. And then you all, as advocates to your representatives, can join everybody else in saying, making sure that their policymakers are making the right choices when it comes to making the serious choices that they have in front of them.
So
And
you
that,
just answered one of the questions was, how can we help? And I guess that's to talk to our legislators, right? And say, this has to stop. And we need to find a solution. So I think advocate is that at this point, I think that's our only solution.
and the one thing that I would say is we have to, and I understand and appreciate the affordability of healthcare as a challenge in the United States. You know, we all know that that's the case. So there do have to be improvements. There have to be gains for sure. But just saying that we're going to fund this all from fraud, waste, and abuse is just not a reality. Because at the end of the day, the hospitals are going to have to keep their doors open 7 days a week, 365 days a year, 24 hours a day. And that's, you know, I say we have to, we want to. That's what we want to do. But to say that fraud, waste, and abuse is going to fund $1 trillion in the country is just not a realistic picture. And there's not a depth of design as to how this would actually play out without completely undermining the healthcare system in the country right now. So I think when you do talk to your legislators, you have to push past the, oh, it's fraud, waste, and abuse. There has to be more design than that. And that's what we're really advocating for as a hospital system.
Right. Right.
That's fascinating. I mean, to be honest, I didn't. Fraud, waste, and abuse was not at the top of my list of how we would be fixing it. I didn't even, that's the first time I've heard that, which not to say, you know, that I read everything, but it's so fascinating that that would be a look, right? Because we can't hardly track fraud, waste, and abuse as it is. And so I just find it very fascinating. Are there other places that, you know, does North Memorial or other, you know, organizations have foundations and have charitable arms or anything like that, which I know are probably already overly, right, tapped, but are there other places that are other charitable organizations that could help in any of these cases?
I mean, we certainly advocate all the time to philanthropy, but what I would say there are a lot of growing needs for philanthropy out there right now.
Yes.
Hospitals are just one. We get several $1 million a year, but you know, $3.5 million in the face of $170 million underpayment. I just got updated statistics for the year. 75% or $75 million of uncompensated care, including $40
Yeah.
million of bad debt, which is what an account looks like if you were on Medicaid and are no longer on Medicaid. It's more often than
Yeah.
not going to be bad debt. So it's
Yeah.
the amount of philanthropy opportunity is dwarfed by the
Yes.
magnitude of the impacts.
Yes. Thank you. Thank you for that. Um, let's see, is there,
That said,
is
if
it time?
anybody's interested in participating in our foundation, I will take your call all day long because it does.
Make
Are
a
there
plug
other-
for that.
I know we're waiting for questions towards the end, but I'm curious, are there other states that are in a SIP? I mean, to some extent, North Memorial is a Switzerland, right? They're not affiliated with a big health system. And so are there other states that have sort of a Switzerland type model that you've networked with that have come out of this or have had strategies? I would guess probably not, but
No, I mean every state's got I think mix of independent systems and larger systems, and you know I think in a lot of regards it looks a lot like Minnesota. What I can say is there are some states that are much more dependent on Medicaid than even Minnesota. We were just successful in the last legislative session of getting a program through that would have drawn down more federal dollars that matched a program that many other states have. It's called Medicaid directed payments. We got it through the state legislature, and then I think at this point at the federal level, it's probably a non-starter, but there are many states that already get that. And so this truly is a nationwide problem. I don't think any one state has a panacea of design that's going to allow this to not be an impact.
Thank you.
I'll add to that a
So,
little context before we go to
yes.
Q&A. We
Yeah,
are
okay.
national partners on the national level is the Center on Budget and Policy Priorities, and they're the ones that sort of govern our network of organizations.
Mhm.
And so we're in deep conversation with them and with our partners who are doing similar work in the states and working with advocates to and their state agencies to try to design responses to HR1 to again mitigate the harm to people, to upgrade IT systems. That's probably Minnesota's and the county's number one problem. And so that's high on our list. And then there's ways, provisions, and guidance that so far has been provided by CMS that we can design a system to protect as many Minnesotans as possible and make it as the doctor said, as easy as possible to people to remain on Medicaid and to get onto Medicaid. So we're learning from other states and kind of across the nation on how best to start to implement this on an agency level and then on a county level. We're listening, and so there's tools available to policymakers, and that's what we're going to be leaning hard on to learn from what we're gleaning from our national partners on how best to design this new world that we are supposed to design.
Thank you. That's super helpful. Any last comments, Trevor or Laura, before we go to open it up for questions?
Well, I would just like to say again, thank you for your interest in this topic because it is absolutely critical. I do think getting our legislators to vote to solve the problem now that this is going to
Yes.
create in the state. Healthcare is incredibly complex, and there's 1,000 different ways that we can solve this problem. But if we have the impacts today and don't have the solutions for years, that's going to be a recipe for not having the same strength of healthcare that we've enjoyed in Minnesota for a lot of years. North is absolutely here for our patients. That's all we want to do is serve patients 24 hours a day, 7 days a week, and be around long enough to make that impact 10 years from now and 20 years from now. So if I can be helpful for anybody on this call or for the league, please just reach out because our interest is just that, to be here for decades.
Thank you. Thank you so much.
So the way
Laura?
I'll dial up. Oh, sorry.
the
No,
way
go
we
ahead,
can
Laura.
help you the most, Trevor, is by talking to our legislators, right? And advocating for North and yeah, funding to keep North in business.
Well, and what I would say is talk to your friends too, because I understand
Yeah.
this is, the New Hope League, but those ambulances that serve, northern Minnesota are just as critical and just as likely to be impacted. Family, friends, just, it doesn't have to be a political thing. It just has to be we want healthcare for our state. And right now, the one big beautiful bill, HR1, whatever we want to call it, represents an immediate threat because the solutions that replace it aren't necessarily immediately available.
Thank you.
Right. Yeah, I would say talk to your friends and neighbors. If there's a way to have, these types of presentations in every corner of the state, it is not going to be too much to talk about this as often as possible. And really and dial up the urgency to your immediate representatives, both on the county level, frankly, on the city level, and anybody who can listen. And then as a community, dial up that message to your policymakers at the state level. I think, and Trevor, you mentioned this, I think people are a little paralyzed and they're thinking that what we're hearing is they're waiting for guidance from CMS and from the federal, and we don't know that that's even going to come. And if it does come, it's in July, which is much too late. We've already wasted plenty of months, in my opinion, waiting for some kind of guidance. And so the urgency is absolutely critical. So I would say urgency and talk to as many folks as possible and then push that message up to the governor's office and your state representatives. And then we'll be an army of folks in your communities as well, just giving you, talking points, giving types of resources that allow everyday folks to just really advocate about saving and preserving this strong health system that Minnesota has.
Laura, I echo what you're saying. I would love to stay in contact with you so we can educate the leagues in our area. They therefore can go to their elected or hope to be elected officials and say, this is what we need.
Yeah, we've got a couple people come off mute. So if those who came off mute, would you like to ask a question or make a comment? Please do so.
This is Julie. I spent 6 hours one day and 3 hours another day trying to reach a medical assistance worker regarding my mother. So it's not easy to apply and reapply for this program. Just
Mm-hmm.
want to point that out, that
Thank you. Yep.
not everyone has the capability to do that.
Do
And
appreciate
you
that.
know, Julie, I think that's a story that needs to go to a legislator. You know, those
There
stories,
was,
whenever I
yeah.
meet with a legislator, the first thing they say is, tell me a story.
Senator Russ, did you have a comment? I noticed that you had come off mute. Oh, you're still on mute. Oh, you're still on mute. And there, while Senator Russ is getting off mute, there was a couple comments. If you look in the chat, somebody, Karen asked about the legislators. Do you talk to them directly? How do we hold can we hold them accountable? And Laura answered that yes, that there's constant conversation and advocacy with policymakers, especially, AHH, Health and Human Services committees. And
I would,
obviously you can.
I would,
So,
I would echo that from both from a North perspective as well as the Minnesota Hospital Association. We're in regular contact with many legislators. Senator Ress knows me all too well at this point, but she is one that I absolutely trust and gets it very, very well what we're trying to accomplish here.
go ahead, Senator Rust.
Well, thank you. I was smiling at Julie's remark about tell me a story, because that is indeed the way a lot of policies get made, by hearing one story after another and looking for the similarities of the challenges in each of our experiences, and then are there common denominators that we can look for to come up with a policy that respects individual differences, but still is available to all, and without sounding too vague about it. That is indeed how policies get made. If you do something that will only help one individual, even though it might help them a lot, that's not really an overall success, quite frankly. So I appreciated that. Uh, that it starts with, tell me a story.
Mhm.
Thank you.
Thank you.
Yeah. So we're at 4 minutes before the hour. So is there any more questions?
I
And
didn't have
or
any more questions. I didn't
closing
have any more
remarks?
questions in the chat.
Okay, yep, I see that. Okay. Do we want to just have, so first I want to say, we can't thank you enough, because this information is so important and impactful. And I learn something from the league every single time I engage with them. I encourage our league members to continue we should continue these conversations. And I want to, thank you so much, Laura and Trevor, for spending some time this evening with you. I'm sure you could be other places with all of your knowledge and your distinguished background. So it is super, super, we are super thankful for you. And I want to thank our members of the league who helped to put this all together, because it is your passion that around this topic that was like, hey, we got to reach out and we got to have these conversations. And I just want to, in the chat, everyone is saying thank you. So thank you so much, Laura, and thank you, Trevor, and thank you, Senator Rest, and all of our other distinguished league members for being here tonight, because this is only the beginning of this conversation for us. It needs to go on and on and on, and we need to be doing all the things, right? Meeting with our legislatures, calling, letters, showing up at hearings, telling your stories, your personal stories, because those are the things that have impact. So thank you all so much. And I hope you have a wonderful evening. And I hope we get some warm weather in Minnesota here pretty soon, even if it only lasts for a minute. Thank you.
The other thing is this will be recorded if anyone would like a copy of the recording. And again, I echo thank you. Thanks, Val. Thanks for your
Thanks.
moderation. Yep.
Yep, no problem. Bye.
Thank you.